Welcome to Conspiracy Deconstructed. Today we're looking into a really disturbing story, opening up internal records from a major pharmaceutical company. We're basically asking, what happens when, the drive for profit clashes head-on with a deadly global health crisis?
We are diving into the tainted blood scandal from the 1980s. And specifically, we're focusing on the actions of Bayer, its U.S. subsidiary Cutter Biological. The sources we have, it's a paper trail. Internal memos, telexes, meeting minutes. A lot of this came out during lawsuits and then through reporting by the New York Times. It gives us this pretty chilling look inside the corporate thinking at the time.
Right. And the theory we're deconstructing today, well, it's less a theory and more something we can actually trace through these documents. It's really tragic. The claim is essentially this. Cutter Biological knew they had a safer version of their blood-clotting medicine, Factor VIII, but they kept selling the older, contaminated version, the one tainted with HIV and Hepatitis C. And they didn't just keep selling it, they specifically targeted markets in Asia and Latin America for more than a year after the safer stuff was available here.
Yeah, it really boils down to this question of corporate responsibility, doesn't it? We're shipping that older infectious product overseas, just a terrible mistake, a system failure, or, as the document seemed to suggest, was it a deliberate financial decision? Trying to get rid of inventory they couldn't sell in the West anymore, protecting those profit margins.
And the human cost. It's just immense. Thousands of hemophiliacs around the world infected, so many deaths. The U.S. saw one of its worst medical disasters ever related to a drug. But these specific documents, they really shine a light on that export campaign, shipping the risky product to places where maybe, just maybe, they thought the oversight wasn't as strong.
Absolutely. And we're not just speculating here. We're using the company's own words, their internal communications, meeting notes, the letters they sent to distributors overseas. There was this guy, Dr. Sidney M. Wolf. He's a longtime pharma industry watchdog. He looked at these exact same documents and he called them, quote, the most incriminating internal pharmaceutical industry documents I have ever seen.
Wow. Okay. So our mission today on Conspiracy Deconstructed is to follow that paper trail. We want to piece together the timeline from Cutter Biological in the mid-'80s. Let's figure out exactly what they knew and, crucially, when they knew it relative to when that safer alternative became available, and then try to understand why they kept shipping the dangerous stuff.
Right. To really get the weight of this, you have to understand what Factor VIII was. Before the AIDS crisis hit, Factor VIII concentrate. It was a genuine miracle for people with hemophilia. Hemophilia means your blood doesn't clot properly. Historically, this led to, really awful joint damage, a very restricted life, short life expectancy.
Yeah, Factor VIII totally changed that game. It gave them the clotting factor they needed, but in a form they could use at home. Freeze-dried, stable, they could inject it themselves, maybe 3 times a week, manage bleeds on the spot. It meant they could live something close to a normal life. Life expectancy shot up, right? From maybe late 20s into their 50s or even more by 1980.
It did, but the way it was made, that held this hidden, really catastrophic risk. See, to make it cost-effective, companies like Cutter, they didn't use plasma from just one person. They pooled it. They took plasma, that's the liquid part of blood, from huge numbers of donors. We're talking 10,000, sometimes even more, people's plasma all mixed together for one manufacturing batch.
Whoa, hold on. 10,000 donors in one batch. So, it only takes one person in that massive pool carrying a virus, and the whole batch is contaminated. Is that how it worked? That scale just seems inherently risky.
That's exactly it. The scale was the risk magnifier. Think about a normal blood transfusion. Fewer donors, less risk. But Factor VIII concentrates the clotting factor. And unfortunately, it also concentrated any virus lurking in that enormous donor pool. And where were they getting this plasma? Often aggressively sourced, sometimes from paid donors, maybe in poorer areas, sometimes even prisoners. So the risk of contamination was already high, even before anyone understood HIV.
And then came the moment everyone realized this miracle drug could actually be a killer. That must have been terrifying. When did the alarm bells really start ringing?
We can pinpoint the official awareness, more or less, July 1982. The CDC, the Centers for Disease Control, they reported that 3 hemophiliacs had contracted this new, strange illness, the one that would become known as AIDS.
And that immediately told scientists.
It's bloodborne, yes. For the epidemiologists, for the blood product industry, that was the signal. The disease could be transmitted through blood. And here's the huge problem. Back then, in '82, there was no test for HIV. None. You couldn't screen the plasma donations. You couldn't check those massive pools. The entire supply chain was potentially compromised.
So the industry knew it was likely in the blood supply, but they couldn't test for it yet. What did Cutter know internally? Do the documents show when they grasped the danger?
They show they knew remarkably early. Get this. January 1983. That's a full year before the safer, heat-treated product was available in the U.S. Cutter's own manager of plasma procurement wrote a letter, and in it, he stated, quote, "There is strong evidence to suggest that AIDS is passed on to other people through plasma products." So internally, they knew. The awareness was solid.
Okay, January 83, strong internal evidence. But what were they saying publicly to their customers, their distributors?
Well, that's where things take a turn. Despite knowing the risk internally, the external message became all about minimizing that risk. It seems they were trying to manage perceptions. By May 1983, a rival company actually brought out the solution: heat-treated concentrate. They found that heating the factor VIII could make the virus basically undetectable. That was the beginning of the end of the danger, technologically speaking.
So a safer version emerges from a competitor. What did Cutter do? Did they jump on board?
They were. While they were slower, the records show they were definitely scrambling to develop their own heat-treated version. But in the meantime, they seemed focused on information control. There's one memo talking about wanting to give the impression that we are continuously improving our product without telling them we expect soon to also have a heat-treated version. It's about managing the message.
That sounds like what you called the message gap earlier, saying one thing outside, knowing another inside.
Exactly. That gap becomes really clear in June 1983. Cutter sends this letter out to distributors all over the world, Europe, about 20 other countries. And in this letter, they actively downplay the risk. They say things like, AIDS has become the center of irrational response in many countries. They even called the clear scientific link between concentrate and AIDS unsubstantiated speculations.
Wait, so just to be clear, January 83, internally, they acknowledge strong evidence it transmits AIDS. 6 months later, June 83, they tell the world that concerns are irrational and unsubstantiated. That disconnect, that's really at the heart of the ethical problem here, isn't it?
It absolutely is. It looks like a strategy, right? Keep the market stable, keep selling the old product until their new, safer version was ready. Cutter finally got U.S. approval for their heat-treated factor VIII on February 29, 1984. It's worth noting they were actually the last of the big four blood companies to get that approval. But okay, the solution was now officially available. The era of safe concentrate had begun, at least in the U.S. and the West.
Okay, so February 1984 marks the arrival of Cutter's safer product in the U.S. Now we shift gears. We're moving into the period after the solution existed. This is 1984, 1985. And this is where the paper trail really starts to paint that picture of, well, calculated strategy that's hard to square with their claims of acting responsibly and humanely. We're looking at the next 17 months.
Right, and the absolute core piece of evidence here, the thing that supports the charge of putting profits ahead of safety, is what's often called the dual-track sale. What does that mean? It means Cutter rolls out its safe heat-treated factor VIII in the U.S. and Western Europe starting late February 84, fine. But, and this is crucial, the internal documents confirm that for well over a year, until July 1985, Cutter kept making, marketing, and shipping the old, risky, unheated product. And where did it go? Primarily to markets in Asia and Latin America.
17 months. That's a long time when you're talking about an epidemic spreading like wildfire. And the documents, they don't just show that it happened, they suggest why. People pointing to these records highlight memos where Cutter officials are talking about needing to avoid getting stuck with, quote, large stores of the old product, the stuff that was basically unmarketable now in the US and Europe because the safer version was out.
You have to put yourself in their shoes, financially speaking, to understand the pressure. Making factor VIII was expensive, sourcing all that plasma, paying donors, the purification process, storing it. Huge costs. Once they'd made a batch of the old stuff, that money was spent. It's a sunk cost. Just writing off all that inventory, and we're talking over $4 million worth, would have meant a big financial hit. It could affect their quarterly numbers, maybe spook shareholders, cause problems for the managers.
So it wasn't just about clearing shelf space. It was about protecting the bottom line, protecting profits. The internal telexes even mentioned this, right? Something about preserving several large fixed-price contracts they had with distributors overseas.
Exactly. Those contracts likely locked them into supplying a certain amount of product at a set price. Switching everyone immediately to the new, potentially more expensive heat-treated version might have broken those contracts or eaten into the expected profit. And this financial pressure leads right into the second major piece of evidence: managing inventory and actively delaying safer options. Think about this. It's November 1984 now. That's 9 months after the heated product launched in the U.S. There's a meeting at Cutter, and the minutes state, just plain as day, there is excess non-heated inventory.
Just like that, excess inventory. So what did they decide to do about this excess?
The decision seems immediate and strategic. Right there in the same meeting minutes, they lay out a plan. They're going to, quote, review international markets again to determine if more of this product can be sold. It reads like a conscious, proactive search for places to send the old stock, the stock that Western markets didn't want anymore, what victims groups have called dumping grounds.
And did they find buyers? Did they manage to sell off this excess non-heated inventory?
Oh, yes. The records show the effort paid off, if you want to call it that. In just the first 3 months of 1985, remember, the risks are undeniable by this point. Cutter shipped over 5 million units of the unheated concentrate overseas. Overall, the documents track more than 100,000 vials of the old stuff, worth over $4 million, being exported after their own safer product was available and being sold in the West.
It's staggering, and it wasn't just passively selling off old stock, was it? There's evidence they actively tried to slow down the adoption of the safer product in some places. Tell me about the Japan situation.
Right, that's probably one of the most shocking bits of evidence proponents point to. It's April 1985. Cutter officials are discussing Japan, and the documents record them talking about potentially trying to, quote, influence a delay in introduction of heat-treated product there. Why? Specifically to help them get rid of the older, unheated inventory first.
They actually discussed delaying the safe product to sell the dangerous one.
That's what the minutes suggest was discussed. Now, Bayer later said, look, that specific idea influencing a delay in Japan, it wasn't actually acted upon. Okay, maybe not. But the fact that it was even on the table, that it was seriously discussed in a corporate meeting and written down, it reveals a mindset, doesn't it? The arrival of the safe product wasn't seen primarily as a public health victory, but as a financial problem, because it threatened the value of their existing inventory.
That mindset seems to explain the third piece of evidence you mentioned. Downplaying the hazard to foreign distributors. What happened in Hong Kong?
This is really concerning. Late 1984. A distributor in Hong Kong, remember, this is a person the local doctors and patients trust. They express interest in getting the new, safer heat-treated Factor 8. Makes sense, right? But the response from Cutter, recorded in the documents, they told the distributor to, and this is a direct quote, use up stocks of the old medicine first, before they'd switch them over to the new, safer version.
Use up the old stock first. They actually told the distributor to keep selling the potentially lethal product before they could get the safe one.
That's what the record indicates. Imagine being that distributor. You're hearing about AIDS, you want the safer product for your patients, and the manufacturer tells you, nope, sell off the risky stuff first. That instruction directly put patients in harm's way.
And things got worse in Hong Kong, didn't they?
They did. By May 1985, hemophiliacs there started testing positive for HIV. Local doctors were getting alarmed, asking publicly if Cutter was essentially dumping AIDS-tainted medicine into less developed countries. It was becoming a public accusation.
So Cutter is facing direct accusations of dumping unsafe medicine. How did they respond then? Did they finally stop?
No. They doubled down on that message gap. Even as this is happening, even though internally a task force had apparently raised ethical questions about continuing the shipments. In May 1985, Cutter assured that same Hong Kong distributor that the unheated product posed, quote, no severe hazard. And they added it was the, quote, same fine product we have supplied for years.
No severe hazard. In May 1985, after everything they knew internally, after the safer product existed for over a year, after people were testing positive, the evidence really seems to stack up. Knowledge of the risk, a safer alternative available, and then documented decisions to keep selling the old product, manage inventory, downplay risks, and even consider delaying the safer option, all directed at specific overseas markets.
And when you start cross-referencing these internal company documents with what regulators were saying, and importantly with what happened to the patients, the picture becomes even clearer. The claims of neglect, of that two-tiered system of care, they get systematically verified.
Let's look at the regulators. What was the FDA, the U.S. Food and Drug Administration, doing while all this was going on? Did they know Cutter was still shipping the old product overseas?
They certainly found out. In May 1985, that same critical month, Cutter was telling Hong Kong, no severe hazard. The FDA's top blood products regulator, a Dr. Harry M. Meyer Jr., called a meeting with Cutter and the other blood companies. According to Cutter's own documents about that meeting, Dr. Meyer accused the companies flat out. He said they'd broken a voluntary agreement they had made to pull the old, unheated medicine off the market. He called the continued overseas shipments unacceptable.
Unacceptable. That's strong language from a regulator. So what did he do? Did he order a recall? Let the public? Congress?
Well, this is where it gets really murky and, frankly, disturbing. According to Cutter's notes from that very meeting, Dr. Meyer didn't want a public fuss. He apparently asked that the whole issue be quietly solved without alerting the Congress, the medical community, and the public. And another company's summary of the same meeting backs this up. It said the FDA wanted the matter settled quickly and quietly.
Quietly solved. Why on earth would the FDA want to keep something like that quiet? If shipments of a dangerous product were unacceptable, shouldn't everyone be warned?
You have to think about the institutional incentives, perhaps. The FDA was responsible for ensuring the safety of drugs made in the U.S., even those exported. If it became public knowledge that U.S. companies were knowingly shipping contaminated blood products overseas after a safer version existed, and the FDA hadn't stopped it sooner, well, that would look incredibly bad for the FDA. There could have been congressional investigations into the FDA's own oversight failures. It could have damaged the reputation of the entire U.S. pharmaceutical industry globally. Billions in trade could be at stake. So maybe, just maybe, keeping it quiet served the FDA's interest and perhaps broader commercial interests, even if it wasn't best for public health transparency.
That's deeply troubling. Okay, so the regulator knew but wanted it handled quietly. What about Bayer's main defense? They argued the foreign countries were just slow to approve the new, safer product, right? That the delays were bureaucratic, not deliberate stalling by Cutter.
Yes, that was their primary public argument. We couldn't sell the new stuff because they hadn't approved it yet. But that argument doesn't really hold up when you look at the timelines in specific countries. Take Taiwan, for example. Health officials there stated on the record that Cutter didn't even apply for permission to sell the new heat-treated medicine until July 1985.
July 1985. But the product was approved in the U.S. back in February 1984. They waited a year and a half just to start the paperwork in Taiwan.
Exactly. If the delay was purely down to Taiwanese bureaucracy, why the 18-month lag before even submitting the application? It suggests Cutter wasn't exactly rushing to get the safer product approved there, while they still had old inventory and contracts to fulfill.
In Hong Kong, what was the regulatory situation there?
Even clearer. Dr. Cindy Lai, who was Assistant Director of Health there, pointed out that getting an import license for a standard medical product back then usually took about a week. 1 week. Yet somehow, it took Cutter over a year and a half to get approval to sell the heated product in Hong Kong. Again, the delay seems to stem from when Cutter decided to apply, not from excessive red tape on Hong Kong's side.
So the regulatory delay defense seems pretty shaky based on the facts from those countries, and this delay, whether regulatory or corporate-driven, had devastating human consequences.
Horrifying consequences in just Hong Kong and Taiwan. The records indicate more than 100 hemophiliacs got infected with HIV, specifically from using Cutter's unheated medicine after February 1984, after the safer alternative was available from Cutter in the West. Many of them died from AIDS.
You mentioned a doctor in Hong Kong earlier.
Yes, Dr. Chan Tai-Kwong. He confirmed that 40% of his hemophiliac patients ended up HIV positive. And he remembered when they started begging for the heated concentrate, they were told, essentially, that there wasn't enough for Hong Kong. Maybe just a little bit reserved for the patients who complained the loudest.
That's just awful. Being told the cure exists, but it's not for you. It really lends weight to what that mother said, the mother of the young man who died in Hong Kong.
It does. Her quote is so powerful and cuts right to the heart of the injustice felt by many victims. She said, "They did not care about the lives in Asia. It was racial discrimination. That perception that their lives were valued less, that safety standards were different depending on where you lived, it became a central part of this tragedy."
And it wasn't just Asia, was it? The problem was global because the plasma supply itself, sourced in the U.S., was compromised.
Exactly. Thousands more were infected worldwide. Japan was hit incredibly hard, over 1,400 hemophiliacs exposed to HIV. Hundreds died. Canada, Italy, France, other parts of Europe, anywhere that received contaminated concentrate traced back to the U.S. system, felt the impact.
How was accountability handled? Did Bayer and the others face consequences?
The response was, well, it varied dramatically depending on the country. In the U.S., Bayer and the other 3 main companies involved eventually settled lawsuits. They paid out around $600 million, which sounds like a lot, but it averaged about $100,000 per victim for the roughly 6,200 hemophiliacs infected in the early 80s. Crucially, though, those U.S. settlements came with no admission of wrongdoing. They paid, but they didn't officially admit fault.
But it was different elsewhere.
Very different. In Japan, the settlement was much higher per victim, around $420,000 each, paid by both the industry and the government. And significantly, actual drug company executives involved were convicted and received prison sentences. In France, health officials there went to prison for allowing the continued use of old, unheated stocks in 1985 when they shouldn't have.
Prison time in Japan and France, but civil settlements with no admission of guilt in the U.S.? That's a stark difference.
It really is. And it makes you wonder, doesn't it? Did the fact that the FDA apparently wanted the issue quietly solved in the U.S. contribute to the companies facing less severe consequences, maybe avoiding criminal charges here, compared to the accountability demanded in France and Japan? It's a troubling question.
And throughout all this, what was Bayer's official line? Did their stance change?
Not publicly. Their consistent statement, repeated over the years, was that Cutter had behaved responsibly, ethically, and humanely during the entire crisis. They maintained that all their decisions were based on the best scientific information of the time and were consistent with the regulations in place.
But that defense, based on the science of the time, it seems to completely ignore the internal documents, right? The document suggests they knew more earlier and that ethical concerns were raised internally, even by U.S. regulators at that May '85 meeting, but were seemingly overridden.
Precisely. The internal paper trail contradicts the public stance. The best scientific information clearly pointed towards heat treatment being safer from early 1983 onwards, and definitively by Feb '84. Yet the actions described in their own records suggest commercial factors heavily influenced the 17-month delay in stopping shipments of the old product everywhere.
So stepping back from the specific documents in the timeline, this whole story, the Bayer Tainted Blood Scandal, it's more than just history, isn't it? It taps into something deeper about why certain stories, especially those involving corporations and harm, really stick with us.
Absolutely. I think the reason this particular case resonates so strongly, why it feels like more than just a tragic accident, is because it provides something the human mind often craves when faced with large-scale suffering. A clear narrative of cause and effect and identifiable actors. It wasn't just a virus. The documents suggest it was, at least in part, a decision made about excess non-heated inventory in a meeting room. That specificity, that paper trail pointing towards intent, removes the ambiguity. It identifies an enemy, if you will, corporate strategy, prioritizing financials over safety.
And it hits that nerve of lost control, too. Hemophiliacs depended utterly on this medicine. They trusted it with their lives. For that very thing, the thing keeping them alive and well, to become the source of their death, it's a fundamental betrayal. And then finding out the company potentially knew and delayed the safer option, that shatters trust completely. It makes the company seem actively malicious, not just negligent.
And critically, it validates that deep sense of injustice, that feeling of global inequality. The dual-track sale isn't just a business strategy. It feels like proof that safety standards weren't universal. Safer medicine for the West, older risky inventory for Asia and Latin America. It confirms, in the minds of many victims and observers, that where you lived determined whether you got the safe product or the dangerous one.
That quote from the mother in Hong Kong about racial discrimination, it captures that perfectly. It wasn't just about money. It felt like a valuation of life based on geography or market power. It provides that powerful emotional confirmation that the tragedy wasn't random. It was systemic, maybe even deliberate in its targeting.
And it all comes back to that message gap. The disconnect between what they said publicly, same fine product, no severe hazard, irrational response, and what they knew internally about the risks and the superiority of heat treatment. That documented gap is the proof, for many, that the disaster wasn't just unavoidable. It was actively worsened by deliberate choices, by a profit-driven delay that lasted 17 critical months.
Remember that question raised by Cutter's own internal task force in February 1985. Can we, in good faith, continue to ship non-heat-treated coagulation products to Japan?
Yes. And the records show the answer they came to, effectively, was yes, they continued shipping.
Which brings us right to the core ethical dilemma, the question for you listening. We know heat treatment eventually stopped this specific crisis for hemophiliacs, but the document strongly suggests the disaster was made worse, infections continued for longer, because of a delay driven by wanting to sell off $4 million worth of old inventory and fulfill existing contracts. When does that cross a line? When does protecting inventory, managing contracts, slow-walking applications in some countries, when did that stop being just aggressive business and become criminal negligence, especially when you know you have a safer product that you're already selling elsewhere?
It's a heavy question. We've looked at a catastrophe rooted not just in the limits of science in the early 80s, but seemingly in corporate choices made after the scientific solution was known and available. Mass infection, mass death worldwide, followed by drastically different levels of accountability depending on the country.
Thank you for joining us on Conspiracy Deconstructed as we navigated this incredibly difficult paper trail behind the Bayer Tainted Blood Scandal.
We really encourage you to think more about this complex interplay between corporate power, global health, basic fairness, and the devastating impact of that message gap, the difference between internal knowledge and public assurances.
What really stands out to you from the story was Cutter's handling of its inventory a calculated risk that went tragically wrong, or something worse? And what do those different legal outcomes, settlements versus prison time, tell us about how justice works, or doesn't work, across borders? Let us know what you think.